So I'd like to call the Health and Human Service Committee together as a meeting. We have a quorum. We have Cateri Walsh, Counselor Walsh, who's a member of this committee. And we have Helen Colton, who's our health commissioner. Very fine health commissioner,
Very
very
fine.
thorough. And she's made available these charts.
And introduce yourself.
And I'm Brian Santinello, and I'm the chairman of the committee. Thank you so much. So Helen, we called this basically to talk about the new COVID variant that is, seems to me it's spreading pretty fast and pretty wide. And also this is the flu season.
Yes.
So that it's like a double whammy. Is there a specific shot that people can get a vaccine? It's probably a little late for that now, but especially seniors. So if they get this, they might get a milder form of it with a vaccine.
So the CDC is telling us that the vaccines that are currently out there are vaccines that are effective against the XEC variant. But if I can just take you through some Springfield data, just so you
Yep.
know where we are
Yep.
as a city.
Yep.
And I need my glasses.
So what do you call it? XC3?
It's XEC.
Yep.
XEC.
XEC is the new variant, and the city of Springfield, I don't have glasses. I never have my glasses when I need them.
You can never find a pen.
We all have our barriers,
Even
right,
though-
Counselor?
Even though the pocketbooks are bottomless.
And that's the reason I can't, I thought I was doing well by, let me just. Okay, so on first page is how we look at the COVID-19 pandemic. So let me start
Yep.
with the first page.
Okay.
The first page, if you look at in the middle, this is Hampden County, actually. If you look at in the middle, you see the green.
Yep.
The green is the variant that we are discussing right now. The XEC variant is
Yep.
what we're discussing. That is in the green. So you see that in the city of, in Hampden County. I can't pull out just the city, but Hampden County.
Yep.
So you see that variant there. However, if you go to the next page of indicator 1, you look at that green and you see how large it is.
Oh, yeah.
That is the United States. So the city of Springfield is not having the same impact as the United States. But it will come. So I don't want to just say, you know, we're out of the woods or we're not impacted. We are, but not to the degree that the whole United States is. And then I'm going to move you to indicator number 2. The next thing I always look at is the wastewater. Wastewater does give us some indication of what is going on as far as COVID-19 is concerned.
Well, how does the water do that?
So the Springfield, the water department does do the testing to see if there's COVID-19 in the wastewater. And hi, how are
I
you?
just wanted to join the meeting and listen to see what's going on.
Sure. You want to introduce yourself? I just was on C3 meeting with Rochelle this morning, so we're continuing.
Hi, Rochelle Lee, just a city resident.
Welcome.
We just started on the new COVID variant.
Let me find a page for you so you can follow along.
You're just curious because like we're acting like COVID has gone away.
Oh,
And I'd like to find out as much information. as
So
I
we're
possibly
talking
can.
about the XEC variant. That's why Counselor Santinello called this meeting, because there is a new dominant variant that is out there. And so we started by talking about I go through, this is the kind of presentation that I do when I look at all of the factors. So we talked about indicator number 1, which is the dominant variant for Hampden County. And you'll see that that variant is not as large as, if we go to the next page, this is the United States. So you can see that XEC variant is extremely high across the United States right now. It's probably about 55%. It was 45%. Oh, I'm gonna say a couple of, maybe 3 weeks ago, but it's now at about 50%. So the XEC variant, they have it here at 45%. And then they're saying 40 to 61%. But the new data that I read for this week, it has gone up a little higher, okay? Then the next thing I look at is the wastewater. So the water and sewer test the wastewater for us to see if there is any COVID-19 virus in the wastewater. And then they give me a report. This is the report that you're seeing. And you will see that from December 1st until January 1st, it has been a bit of a roller coaster, but certainly has been going up. So the wastewater tells us what's going on as far as, the potential of COVID-19 transmission. It's in the wastewater, which means that when our residents, when we urinate into the wastewater, that is really tested by the water department so that we know that there's virus there. The next page, sure.
Can they locate geographically where the virus is coming? Like, would there be like one neighborhood that is prominent? Would they be able to tell something like that?
I have not asked them about neighborhood council, but that's an excellent question. I always ask them to give me the city of Springfield and Hampden County, but I can ask, can you break that out further and give us neighborhood-based data? So I'm gonna write that down so I can.
They'd probably like that at some of the sector meetings too.
Yeah, neighborhoods. So this is per 100,000 residents, but you'll see it's going up, but it's taking a dip down. And so a bit of a dip, not much, but wastewater is another thing that I look at. The other thing I look at is the cases. What are the cases in the city of Springfield? Springfield has 141 cases. Now that's larger than West Springfield, Westfield, and Wilbraham. That's because our population base is more. So it's not that we have more cases per 100,000, it's we have more people per 100,000. So 141 is the data, and this was through January 4th, 2025, which is the latest that I have.
A question on that. When people take a COVID test at home and they test positive, they're not reporting that to anyone.
That's correct.
So how do we know what the true numbers are?
We don't. We don't.
Yeah.
And you are absolutely, I was going to mention that next, that 141 does not include home tests. So you're absolutely right. Question?
So the 141, how is it determined? Because I think one of the things for me that was really helpful, I only had COVID once, and that was in 2023. But what I did was I home tested, but because I wanted that information to be in a database, I went and drove through and got tested so that at least the state would have those numbers. My question is, how are these 141 cases identified, like by hospital testing or?
By hospitals, doctors' offices.
Okay.
Anytime there is a positive communicable disease, it has to be reported to the state. So if your doctor's office, you're positive there, you're positive in the hospital, then in fact, that will show up in the numbers. But it will not show up for home testing to Counselor Santinello's point. So 141 was updated on January 9th. And that was the number through January 4th. And then if we move to the next page, now this page really is relevant because it looks at population base. So what you see is West Springfield is more than us, Wilbraham's more than us, Westfield close, and then Southwick a little further down. But Springfield is not outrageously impacted in terms of this number. So we can see that cities and towns around us also have numbers.
Does that surprise you that we're not like number one? Because as you said, like the population, we have more people.
Yeah, this is adjusted for population. This page that I have, the cases, is adjusted for population, but the other page that I went through with you was not adjusted for population. That 141 was not adjusted for population base. So this is the percentages based on population and where we are per 100,000. Remember, that's 90.4 per 100,000 population. And all of these are per 100,000 population.
It's kind of high, given that we're like, what, 156,000 or something like that?
151, yeah.
Yeah.
Yeah, I don't know that. Look at the other cities and towns. So we're somewhere in the middle of those. So based on population, it does not appear to be that high based on Hampden County's numbers and what we're looking at in Wilbraham, Westfield, West Springfield. What I don't have here and wasn't able to get is Holyoke and Chicopee. That to me is always more more consistent with the city of Springfield based on population. So I was looking for it, but it was not there. But so that's that one. And then hospitalizations. So hospitalizations are important because we look at hospitalization. If you look at Springfield, it is that 4.4%. So what that means is 4.4% of all hospitalizations in our hospitals were COVID related. So that is, if you look around, you see there are cities and towns that are less than us, but there certainly are cities and towns that are comparable to us and more than us.
So is that the 13.6? Is that Nantucket or is that?
It looks like, is it Province? I'm not sure. It's one of the islands on the Cape, right?
It's 13.6.
Well, even, I don't know who that is above us. That's the 7%. I didn't pull it out. And then we have the 7.9%.
This would be like Northampton.
It could, well,
Northampton, yeah.
it definitely, I believe it's either Hampshire or Berkshire County. I mean, those are the two counties that are impacted there. But Springfield, 4.4% of hospitalizations were COVID related. Does not mean they went in the hospital for COVID. It means they could have tested positive once they got there, but 4.4%.
Do we have any numbers on fatalities with the seniors on any of
Yep,
these
I'm gonna
numbers?
give you that in a second.
Yep.
So then if I move, and this is just the way I look at indicators, when I look at it on a weekly basis, hospitalizations, then the hospitalizations. So hospitalizations in general, the level of low baseline for hospitalization is calculated based on the baseline of 5.7% for the 2024-2025 season. Therefore, weeks when 0.0 to 6.3 of hospital admissions are related to COVID-19 classified as low baseline. We are low baseline at this point.
Yeah.
The next slide is the one you asked about, Counselor. And you can see that if you look at that line represents individuals over the age of 65. So that top line, you can see that most of the cases that we are seeing in the city of Springfield, in our region, are over the age of 65. So that is who is most impacted right now by COVID-19 in the city of Springfield.
Are any of these people that are hospitalized or been hospitalized, are they on ventilators?
They could be. We don't know the status, right? What we do know, and we'll get to that in a second, we do know when an individual dies, and that obviously impacts us and families. So over the age of 65, that's our most relevant group. And then, so last week, December 29th, there were 12 confirmed COVID-19 deaths and 2 probable COVID-19 deaths. So
From the new strain?
it's it will not tell us what strain it's from, okay? We know the strains that are circulating, but if the hospital is able to pull out, that is not what the death certificate says. So when we get the burial certificate, there is a diagnosis, and the diagnosis will say it's related to COVID-19, but it will not tell us what that strain is. And that's why we look at that other data that we talked about. So that's deaths. We have 14 deaths. I'm sorry, we had 14 deaths, 2 probable COVID-19, which means probable is they were not able to determine to the satisfaction that it was COVID-19, but based on the variables, it is probable. So confirmed and 2 probable.
So that's 14 like in a month?
That is 14 from December 29th to January 4th.
And that's not even a
Wow.
month.
No.
December 29th.
Yeah,
Yeah,
that's,
so
that's
December
amazing.
29th.
Yeah.
To
That's a
January
lot.
4th, there were 12 COVID-19 deaths and 2 probable.
Now, how does this compare, Helen, to 2019, the peak of the pandemic, or 2020? Are these, are we still losing a sizable number of people?
We're still, individuals are still dying from COVID-19. And I think the reality is that, I mean, we want to go back to that 65 and over. Individuals with compromised immune system who have chronic diseases, I mean, that has not changed for us. I mean, we know who is most at risk, and that's what you're seeing in that 14 is those individuals primarily over the age of 65.
Does the cold have an impact, do you think?
The weather,
Yeah.
the cold weather, I mean, it could,
Because it's
but
been so unusually cold.
I also think that the cold might play a part in this particular way.
Yeah.
People are more inside. So like, people are gonna stop by and see grandma. They're probably positive. They don't even know they're positive. And it kind of spreads that way.
I think you're right that we just came out of a holiday season, I think is the point. And we were
Yeah.
all gathered together, we were indoors and celebrating with each other. And I'm absolutely sure that that has
Well,
an
Spent
impact.
most of the vacation going to funerals.
Yeah,
So that's 404 potential deaths, 347 confirmed, and 57 probable just in this season, and we're not through when does this season end?
usually in March. We
And when
start,
does it begin?
we start vaccinating in October and September. September, October, we start vaccinating. So, yeah, I mean, I think what you're looking at is from July 1st, I think you're counting, Counselor.
Yes.
And then you look at, there were 25 deaths in in October.
Yep.
21 deaths also in October. So the numbers that we're dealing with now, while they are high, any death is not something we want to see, but
Right.
Right.
you know, it's not as much as we've seen during September and October.
We still got a ways to go in the season.
Yes, we do. Yes, we do.
Wow, yeah.
Hi, everyone. Councilor Perez, could I be able to ask a question?
Yes,
Okay, thank you so much.
yeah,
Oh, I did not realize y'all were here.
Identify who it is.
yeah,
Yeah.
yeah.
So
We
when it
have
comes to
Councilor
the
Perez.
elders, Commissioner, are you seeing is the lack of not vaccinating or in that population? Could you elaborate on that? Because I think that's a message that we need to send out there. So I'm asking the question is because of the lack of vaccination? Or why is the increase in the elder population that you might think of? Thank you.
Thank you, Council Perez. That's an excellent question. So, you know, we really, our vaccination rate is low. Let me start there. It always has been, even during the peak of the pandemic, we were out there trying to get individuals vaccinated. We're still doing that. And so our team, when they went over to the Ray Jordan Center to do vaccinations, they may have gotten 35 individuals who got vaccinated, and that was good. However, when we did the other sites, when we did the North End, when we did Hungry Hill, and when we did Claudio, we maybe got 5 to 7 people. So to your point, we try very hard to push vaccinations, and all of the pharmacies, as you know, are doing vaccinations, but you bring up a good point. We still have to continue to educate, particularly our senior population, who the data tells us are the most at risk, the most dying, and the most that are hospitalized.
I'd like to also acknowledge Tracy Whitfield. Counselor Whitfield is here with us. Thank you for joining us, Tracy, and thank you, Maria, for that question. You know,
Can
one of
I-
the things. Oh, go
um,
ahead.
Counselor, can I piggyback off of that?
Yes,
Commissioner, does vaccinations have to happen annually?
Vaccinations for COVID-19, yes, that is an
Okay.
annual process. The only vaccination that is not annual is pneumonia. So pneumonia vaccinations can last from 5 to 10 years, depending on the age of the individual. However, flu and COVID and RSV right now should be an annual vaccination.
Okay, gotcha. And Brian, can you just repeat the numbers that you said? I came in on the tail end.
yeah, from July till now, January 1st, there's been an estimated total of 404 COVID deaths reported. And the thing that alarms me is that the general public thinks COVID's over.
Right.
Yeah,
And that's why they don't go for vaccinations, fearing that there's no real risk, and there's a huge risk, especially people that have comorbidities and their age.
mhm.
And
And that's just in Springfield?
Yes, let me see. The last week, we have had a total of 347 confirmed COVID-19 deaths and 57 probable COVID-19 cases this season. And so that is the seasonal number. Again, I just want to reiterate, that's why it's important to talk to our seniors, because that's who's showing up in these populations.
well,
Okay.
Tracy, just to follow up on that, because you brought up a good point. What happens when people they just die and it's not reported as a COVID death?
Absolutely.
How many are there that people actually have the virus and died from it, but it's not being recorded? Is that possible, Commissioner?
That somebody dies from COVID and it's not being reported, usually a hospital as well as the physician's office should report if it's COVID. The question is, are they testing? That's the question.
Yes.
And I don't know. And we don't know because we're not the ones who are in charge of that.
See, that's.
I'm also thinking that it might be useful to have
Yeah.
numbers, because people, like Counselor said, people think it's over.
Right.
And I think if the numbers were somehow publicized, that like, this is where we stand with COVID, it is not over, it might encourage more people
To get vaccinated.
to at least get, because I'll be honest with you. I had those 4 vaccinations. I have not been vaccinated since like that early round of the 4 vaccinations. Really for my own reasons. Now that I'm sitting here in this meeting, I'm like, well, wait a minute, I need to rethink that. I do have at least one comorbidity. So I'm thinking that if there were some type of public acknowledgement of like our status with respect to COVID, it might encourage people to think more seriously about it. Because when I walked in this room, I probably would not, had I not been here, I probably would not have gotten vaccinated again. Now I'm rethinking that, so.
I have 3 comorbidities, and now is it too late for me to get a vaccination, or
No.
I can still have it?
Absolutely not. Absolutely
Did you
not.
bring a kit with you, Helen?
If you see me with a needle, run. But anyway.
I'd like to acknowledge Counselor Allen's with us too. Thank you, Tim.
So we've gone through the COVID-19. I'm going to do 2 more slides.
Yep.
With you, and then we can go into conversation. This one really doesn't have to do with COVID, but really, really just touches me.
Yeah.
So that under the age of 5 years old, RSV, look at that number. Look
Wow.
at that blue line going up, up, up. It's
Wow.
coming down a little bit, but what we know is that RSV right now, unlike COVID, is impacting children under 5 more than anything else, any other population. So you can see that. So it's important just to acknowledge that while we're talking about COVID, that we continue to keep in mind the other variants or the other vaccinations we should consider.
Look at the flu numbers.
And then I'm doing flu next. And so the flu numbers are numbers that again, look at that 65 and over population, right? So when we look at flu and we look at COVID and we think about both of those, then that's why we're seeing the senior population really impacted by those. But RSV is more impacting youth under the age of 5.
And are those symptoms, do people know what they are in kids under 5?
They're pretty much the same symptoms that you're seeing with any other respiratory. It's a respiratory virus, and so it's the same kind of symptoms that you see with most of these respiratory viruses. That has not changed.
Helen, on the test kits, I had like a slight cold the last, not the last couple of days, but last week. So immediately I tested several times for COVID and it was negative. How do people get those test kits again? So that if they do come down with something and they think it might be more than the flu, where can they go?
So every Tuesday and Wednesday, the Department of Health and Human Services is handing out test kits. Our test kits, we give 4 along with a mask and some hand sanitizer. Our test kits don't expire until July of 2025. And so any resident can come to the department and pick up test kits if they'd like.
And they're entitled up to 2, they can get 2?
We usually give 4.
Four test
We
kits,
usually give 4 because,
2 to a kid.
yeah, there's 2 to a kit. That's correct.
Um,
What's the address? 311 State Street. We're on the corner of State and Myrtle. You'll see some cones that on Tuesday and Wednesday, there are cones out there where you can just, drive up.
You don't have to, get out of your car?
Yeah, you have to get out your car. We haven't gotten there yet. But yes, you have to get out your car, but you walk right in and we have a gentleman, his name is Fred, who's right there. And he just hands them and you get them and you go out.
Commissioner, could you give that address again for the public, please?
Sure.
Thanks, Maria.
It's 311 State Street. It's on the corner of State and Myrtle Street. Again, you can there'll be some orange cones out there on Tuesday with today, and tomorrow they'll be there, and we hand out the test kits. We obviously we do ask for a name and an address. Although I know that we're all concerned about all residents, I need to make sure that I'm taking care of Springfield residents, first.
What is that near 311 State Street?
It's across the street from where the old welfare, it used to be the sheriff's after incarceration
Yeah.
place.
Oh, okay.
I think I have to bring this up because the World Health Organization just last week called a state of emergency worldwide on the bird flu. This is really frightening because now you've got the COVID variant, you've got the flu, and now you've got to deal with with the children getting the RSV. That now bird flu is it's hitting a lot of states, and where are we with that?
Well, we continue to work closely with the State Department of Public Health, and they continue to put out advisories for the Commonwealth of Massachusetts. We in the Commonwealth are not seeing the same kind of bird flu variant that many other states. We had 1 death. That's the first time in forever that we've had someone die from the bird flu. But I can tell you that the State Department of Public Health is working hard to make sure that we are all informed about particularly those who are on farms working with animals. And they're not concerned about the milk right now.
How about the eggs?
Not concerned right now. There
Okay.
have been no alerts whatsoever, and that's what we depend on, is those alerts from the state.
Helen, are they working on a vaccine for that?
I'm sure they are,
Okay,
but let me say that, because they're always working. The CDC and the World Health Organization are always trying to work on vaccines, so I'm sure they are, but we don't have any updates around when, how, and none of that has come to
so,
me anyway.
so shouldn't we be advising the public not to drink raw milk?
Yes, I think that is something that we could do, but if you look at the Commonwealth, if you look mostly at the city of Springfield, there are very few raw milk facilities that are, that individuals are accessing right now. It's all, to my knowledge, pasteurized in stores, and so the raw milk piece may be something to deal with on the farms. Or, maybe there are individuals who own farms who are drinking raw milk, don't know that. I think the individual that died did have a relationship with a farm animal, and that's how the transmission happened.
Any questions of the counselors or our guest here? Maria, any further questions?
Well, thank you, Commissioner. I think that this is very helpful to the community because we go about our daily lives and we don't look at the vaccine to be as important. I think
Mhm.
this data is helpful because it's telling us that the increase is telling us that we have to take care of the community. So thank you so much, as always, for bringing this information to the community.
Thank you.
Thank you, Counselor.
Tim,
Tracy, or Tim?
Well, I just wanted to say that I think the information is helpful also, because we're not in the mode that we were in before. I think people, like you said, think it's gone and forget about it. And I don't, and even with my aging parent, I haven't had a conversation about like, have you taken the vaccine? Because she was always up on it. My mom was talking about, and my aunts and uncles. Like, I haven't had that conversation with them to say, well, COVID's not over. New strands come about all the time. So it just gave me like insight on we still got to have these conversations. So I appreciate the info.
Yeah, thank you.
Thank you so much, Tracy. And Tim, any thoughts?
I just didn't know if there's a recommendation about like I haven't gotten this last round of vaccines and this last vaccine. And I didn't know if there was a recommendation. Like I'm senior citizen, should I be getting it? I haven't had any issues with cold or sickness or anything, but before it felt like everybody should go get it. Now I'm not so it's discretionary, but is it still recommended?
It is. The CDC, the World Health Organization, Public Health, everyone is still recommending vaccines for individuals 6 months and over. But those of us who are senior citizens, we need to be more vigilant about getting our vaccinations for flu and COVID.
All right. Thank you. I will do that. Thank you.
Thanks, Tim. And thank you, Commissioner, for an outstanding job as always. And we'll just see how this progresses in the next couple of weeks. It seems like you said this will go on until March, the season itself. And I'm sure the numbers will probably get worse before they get better. So we're going to keep the public attuned to what's happening and meetings as they occur. And I'd like to thank everyone for attending this. And I hope the public watches this meeting this evening and gets to realize that this isn't over by a long shot.
No.
thank you for bringing this
Thank
up.
you. Yeah, thank you for bringing this up, and thank you, Commissioner.
Thank you. Maria, I'm going to be at New North this evening. Will you be there?
Actually, I got another meeting. I'm gonna
Okay,
be in and
all right.
out, but we have to touch bases, yes.
Okay, sounds good.
I'm going to get my test kits.
It's gonna be a stampede.
So it's Tuesday and
It's
Wednesday.
CVS.
Tuesday and Wednesday. Mhm. Yeah.
Thank you, everyone.